medicines which we are using, which we are practicing, right? That is source which we have seen, right? For example, cantharis. Cantharis is prepared from, all we know in Spanish, fly, right? So the cantharis what we are getting, it is stripes are there, it is preparing from that. But as we are getting the results similar to cantharis, as it has a similarity more of, so that is what is the genuineness of the product is required. The sources which are there at the Hahnemann time and that are not, but we are getting the medicine profiles. So this will provide a fingerprint profile of herbal drugs, useful for make it ideal for regular use. So we can take the multiple samples together with the help of HPTLC, which we can monitor through the computer, and we can record it, all the profiling and data regarding the with HPTLC. Liquid chromatography, mass spectrometry, right? Spectrometry, this is DCMS. This particular techniques will identify and quantify complex natural compounds. The compounds which are complex in nature, or their complexity, the things which are coming for testing, we can test with this LCMS and GCMS. This will provide the structural details of molecules. So all the molecules of the drugs, we will get the basic structural detail of all this. Widely used for standardization of raw materials and mother tinctures. So this basically help us to have a proper standard protocol for various mother tinctures or raw materials which we are liability, right? So what liability, right? So whatever the existing traditional methods which were already available help us of the medicines, raw materials, mother tinctures, to have a proper standardized protocols, to record them with the help of computers and have a proper standard protocols. So that is Bombay. So these nanoparticles which are particles studies, right? So the traditional thinking of with this modern preparing 1C, 2C, 3C, 4C, continuous grinding process. In succussion also, vigorous shaking and giving strokes create stable nanostructures. The significance of all this is explains why the remedies acts even in ultra dilution. Modern nanosciences for this, right? For a substance on healthy human beings to record the symptoms it produces. The purpose to identify the disease producing power of a drug which forms the basis for its disease curing powers according to the principle of similia similibus curantur, like cures like. I am not going in much details, it is just a highlighting because all you are aware of this. So I am just have a proper understanding of these advances. The participants which has been taking part verified. Now in HPT, international codes, that is declarations of Helsinki, require ethics committee approval. So you now approval, even your institution level or any other university level, at least you need ethical, physical, sleep, digestion, mental, objective measurements alongside subjective symptoms to enhance reliability and transparency. automated potentizer. This is a practical advances what we can see, the automation in manufacturing. So now the manufacturing companies which are more going into the from traditional to automation systems, the machineries are advancing, the potentizers are advancing. Still some have following the traditional system of strokes and all, but many GMP and international companies are adopting the complete automation advantages in the manufacturing industries. So automated potentizers and triturators mimic the manual triturations and suppression with precision, designed to replicate Hahnemann's principle while reducing the variability. Computer number of succussions, useful for large scale manufacturing where manual preparation is impractical. When company has to produce in a very large amount, uniform potency across programs, so that will be automatically handled, so human errors are less. The contamination risk is very poor. Increased speed of production, improve the product quality which has been increased, right? But that is my personal opinion. It is always been a question mark. That is my personal belief, because giving potentize in a traditional, the fluid is changing. Many companies are, instead of using alcohol, they are using water doses, and in the last potencies they are using alcohols and this. So the quality which is there in the handmade potency are still thinking according to this. So raw material also facilitates fast are identified. So the sooner we identify and detect any contamination, we can stop the this factories. So filling wires, labeling, this reduces the manual handling and maintains aseptic conditions. Large scale industry settings, right? So to produce in large amount system, this automatic data learning ensures compliance with the international pharmacopoeia guidelines. Homeopathy will also be produced and manufactured at the require of the time. Ventilations, they have ACs, they have temperature maintenance. Now systems, this is with sensor systems and all, that the air maintain the steps of all this manufacturing, right? Control enhancement, as we know, GMP, which ensures the medicine to the global scenario, right? As we are having multiple MOUs with many countries where we are the leaders in homeopathy, manufacturing, packaging and distribution in this homeopathy, that is verification of raw material will be done properly. The prevention of contaminations, mislabeling or incorrect potencies, which we can see in the last slides when we go into the pharmacovigilance. That is where we have the errors, right? That errors that ultimately lands into the wrong medicines, the bad quality medicine, if wrong labeling or wrong potency has been prepared. So now that all that is done, but inculcating the pharmacovigilance in Ayush system is the need, right? So that we are vigilant enough for all these things which is happening nowadays, so that we can counter these problems and we can get the more quality standards at the global perspectives. Homeopathic specific GMP guidelines, that is dedicated premises with controlled environments, is related things, robotics, AI which is coming up. So that helps in fast production, good production, quality, purity and genuineness. Detailed batch record for mother tinctures, potentize and finished products that will be maintained. Now third part is digital pharmacy management. In digital pharmacy, we have all the computered AI systems nowadays, which help us to maintain all this digital pharmacy. So electronic health records, electronic symptoms and prescriptions, right? So all prescriptions is been digitally recorded. They are ready to available whenever we require, right? That can be shared, that can be utilized, that can be uploaded to the international websites where we can have the authentications, right? Enables long-term tracking of chronic cases common in homeopathy. So more we are dealing in chronic cases, so that also enable us to track to wherever we want, right? Instead of going to the hundreds and thousands, I have seen the patient's records which include 50, 100 plus pages, which are keep on treatment for 5 years, 7 years of many chronic problems. So now this digital platform will help us to analyze and to have a proper understanding what are the dispensing methodologies are used previously and now whatever we are using. Integrated tools, remedy databases and repertories allow quick accurate remedy selection, that is also electronically digitally modified systems. Software integrations of materia medica references, clinical cases and repertory rubrics, that is also a part of our now the as per new CBDC we have to take the student for clinical orientations and training in third term, right? So we have to make them aware of all this system so that they can also learn and understand the clinical part of homeopathy in a digital way. So that is what is been proposed. Telehealth features support remote homeopathic consultations. Now the telemedicines are the new things which came up, and you can treat the patients through video conferencing with telemedicines. So it is easy sitting here and to work the world, right? So that is what is the advances which is done in the system. The benefits of this digital pharmacy is having accurate and secure record keeping, right? It is basically more of a PG level, we should understand these things. Instant access to the patient history, streamlined clinical management, more focus on patient care. EHRs provide structured data for clinical studies and the provings whatever done or whatever clinical studies we are performing in the hospitals or our institutions. The mobile applications remind patients to take medicines on time. There are so many apps which we can use that remind the patients also for taking on time medicines and new methods, applications. Coming next is packaging innovations that has developed tremendously. If you see, and there are so many senior professors are there at that time when they initially started teaching, and that time packaging are very worst. You can see that times and remember they are very local looking packagings and very leakings are there in ointments, the medicine bottles, and this they are not up to that level, right? But nowadays if you see the packaging is very much attractive, colorful and the promising and supply chain for tracking. So all these QR codes are coming so that you can easily, even a bottle single very much increase. Now the blister packing of and colorful packagings, right? Ointments you can see now they are not leaking or they are printed, right? So this is all smart packaging for the verifications and supply chain tracking. using of eco-friendly packagings that has been required. Though we have improved, but now we are going creams and all shampoos. They are very much sprays and so many things which has been of our pharmacy actually, and that has been identified and need by the system, our council, which is very much lacking in our pharmacy, in homeopathy council, and we should use terms of some theory, practicals, and which is right. So at least have some little understanding regarding all these theories. As per the global poll, the system of homeopathy, the O of succussion, that is vigorous shaking, creates and stabilizes nanoparticles of the came up and other methods of these molecules, the possible contaminant resistant result, water when you potentize the potentizations. Now the main critics, so that's why this is been now not more practiced, right, are not been accepted. It's increase, it is more lethal, more toxic, right. So this harnesses theory supports us, as we are having a very minute doses. Our doses of medicine is very minute, nano doses which we are giving, right. Killing mechanism, we all know that. Still we have prepared and we made a confusion. Write the syllabus on time, right, and the student get through of the pharmacy subject. It is a hard fact, right. So the students that so that they can have their career in. So we have to motivate them, we have to make them more aware of the system and what this system in future we have in terms of pharmacy. This harnesses occurs only with measurable concentrations, cannot explain dilutions beyond Avogadro's number, right. So that is I also have this limitation from this. It stimulates sensing the gene expressions and DNA levels without altering the DNA sequence. If it alters, then it is very much difficult to nudge the body's complex biological networks back toward a state of health. Critics of this is basically proven to be a now the conclusion of all these theories, as we have seen the critics and all, these several modern theories have been proposed to explain homeopathy, no effect beyond that of placebo. So now molecular dockings, which is in next slides, which I have taken up, but all this theory, right, we have the limitation. Certain theories are and to understand requirement in future, right. So having all this nanotechnologies, the genetic theories, genetic sequencing, nutrasciences, molecular dockings, that are the new things which is coming up. So these are now this is the promising new things which is coming up, that as I have gone through. This particular thing is a computational method to predict how molecules bind together, potentizing and which we are using, so how they are bind together. So this, the key tool in silico drug development is the study interaction between a ligand, that is a small molecule, and a receptor protein. So there is a bond are ligand between these molecules of drugs and with the receptor proteins. Calculates the binding affinity, that is bond strength, helps to understand how drug fits into their targets. Applications of this in nutraceutical researches that helps in identifying the molecular targets for nutraceuticals. It supports the development of new therapeutics. It also applied in disease models including sickle cell diseases, cancers, cardiovascular disorders, gastrointestinal disorders, reproductive disorders, and neurodegenerative disorders. So all these foundations are interaction between the molecules and the receptor proteins. It helps understand biochemical processes of binding, right? So that is what is trying to show you this foundation of the molecules with the proteins, right? And we can evaluate that. Why this molecular this is crucial for identifying the potential drug candidates, then optimizing the drug properties and designing the targeted therapies of many disease oriented targeted drug therapeutics, right? So that helps in that. The advantages of this molecular docking is it is a fast, it is cost effective, screens thousands of compounds virtually, that is possible, reduces animal testing, it limits need for extensive experiments, and mechanistic insights provides 3D view of molecule targeted binding. Nowadays we can have a 3D imaging also of various molecules and we can help and we can demonstrate, right? So these are the new things which coming up. What future potentials are there of regarding this is the bright future in nutraceutical researches. It supports development of new therapeutics, the bright future in drug discovery for disease treatments, right? So all the new drug discoveries are there, are the drugs which are already existing, so have their molecular docking. That is what we can do. The references of this that I have taken is docking as a tool for the discovery of molecular targets of nutraceuticals in the interface. So, are the advances are happening in the field of homeopathic pharmacy.